Kira Koto. Yes, for those of you paying close attention, the title is a little bit of a downgrade in that we're kind of asking a bit of a prior question before we get into looking at the effects of the families package on child health and development. We're looking at whether we can use specifically the before school check data, so some of the administrative health data that we have within the integrated data infrastructure within New Zealand. So this is kind of an overview of what we could do to assess the impact of families package. So why do we want to evaluate the families package? So what is the families package? So the families package is a package of policies focused on families with children, particularly those 0 to 3, that was introduced over 2018. Kind of central to this was Best Start, as Steph mentioned, which was the sort of universal in the first year initially, and then progressively targeted for babies sort of 1 and 2, which most families, like the sort of 2/3 of families in Aboriginal New Zealand, would qualify and be eligible for some support in those second and third years. And it worked out about $40 a week, $40 a week at the time. And alongside that, there was an extension of paid parental leave that occurred in stages, and introduction of winter fuel payment, and extension of the maximum family tax credit allowance. And so a series really of policies that were introduced, and increasing the accommodation supplement as well, from April in 2018. So it's really kind of a group of policies. What they've got in common, which is apart from the kind of paid parental leave, which you have to be employed to qualify for, most of this package was largely unconditional on employment, and partly universal or broadly based, right, rather than just targeted on the lowest income families. Instead, it was targeted by age. And what's interesting here is, so Jacinda Ardern notes that she herself wasn't eligible because for Best Start, or most parts of the package, because Neve was born before July 2018. And as you'll hear, this has been very important for our ability, this cutoff and the single cutoff date of July 1st, 2018 is very important, but also poses challenges in how we're going to evaluate the families package. And there's great interest, obviously, in outer New Zealand in evaluating Best Start and the families package. We want to know what are effective policies for the tamariki, what are priorities for reducing child poverty and improving well-being going forward. But there's also part of a kind of international policy debate, which really actually just in August last month really kind of exploded in debate, particularly with the publishing of Baby's First Year, which is a randomized controlled trial of payments for low-income families in across cities in the United States over the kind of COVID period. Again, this is going to be relevant, which found that there was sort of no effect on measured health and development outcomes, including maternal well-being and BMI and parental evaluation of child health. So, big debate about this. And one of the, pushbacks around that is that, okay, well, there are effects on downstream on child development, but in a sense, we're also looking at the effects of cash transfers more immediately, and that they're effective because they reduce poverty and they reduce child poverty. And we'll talk about that too. But the point here is just that there's a real opportunity in evaluating the families package to also speak to kind of broader debates about what are effective policies for children and families, and for reducing poverty and inequality and improving health. So yeah, as I mentioned, so there's really the sharp eligibility cutoff for babies born for the families package is really important for helping us to sort of identify its effects on children. So the advantages of looking at the families package from a purely research point of view is that it's a natural experiment. It's natural. It was nationwide. It was implemented in a real policy environment, it was implemented at enough scale that we might see some kind of supply side effects, for instance, or ecological community effects, whereas, in ways that kind of trials can't do. There's no exclusion in terms of like who was recruited for it, for instance. One of the problems with the babies' first years with some of the children who are in NICUs were not eligible for the trial, and so some of the highest risk babies and infants weren't part of that trial. So we've got great data, we've got a great administrative data on this, and we've also got this essentially set up from the natural experiment, which is, I'm going to patronize people, but for people that don't know the sort of difference in differences model, it's really quite simple, and I've sort of taken it out of the equation and just done it in addition and subtraction. So really, it is just literally the difference in differences. It's the difference. In our case, we're going to be looking at outcomes for say, any health, so let's just BMI. We're going to look at BMI for children who were born after July 1st within 2018. And then what's the difference between that and the outcome for children who were born before July 1st, 2018? We also do, because the accommodation supplement was interested in April, so we do it just for that. But basically looking at what's the difference sort of before and after in 2018. And then go, okay, but there are changes. There might be seasonal effects, etc. So let's difference that from any potential other differences that vary by period of birth. Yes, there's some things like, particularly around school starting and things, can vary particularly in terms of seasonality. And because essentially birthday overlaps with seasonality, but we really want to adjust for that too. So we're going to subtract that first difference from some second differences, which is the difference between outcomes being born before or after July in previous years we have good data on, which is from 2013 in the IDI. Now, big caveat on that is that this works to identify the effects we can have confidence in because of causally inferring this is an effect of the families package, provided these differences are kind of what's called parallel across pre-policy years, which means they're not jumping around. If they're jumping around before 2018, how do we know that if they're jumping around in 2018, it's not just random variation, or it's not it's not to do with other factors that we can't observe or we're not aware of in the model. That's just not to do with the families package. And then we also, of course, need to be clear that this difference, so what we see between the differences within 2018 and within prior years is not confounded, it's not confused or coinciding with other changes in the sample of children studied. So for instance, each of these samples we want to say are either broadly comparable, the composition is similar, and the size of them and the proportion of people for whom we have data on is similar enough, or we can adjust for it in our model. So both of these assumptions are really, really key. Now, we know using this difference in difference design, so Keith McLeod and Moira Wilson, I don't know if they're actually here, but they use this initially just to sort of show, okay, what were the income effects of the families package in total? And remember, because we're not really able to isolate Best Start from these other packages, but they were able, in terms of income, to disaggregate this because of all the very detailed MSD and IOD data that we have. And so they found that, just there was a really significant increase. This is over the full 3 years, and on average of, $7,500 over 3 years, which is about, depending on the household income, about 5 to sort of 8% of income. And there was no significant change in employment income, despite these things not requiring employment, unlike sort of working tax credits, for instance. And we can see here just this sort of if we compare Best Start pay by MSD, so these would be people who are on main benefit or other income-related benefits, and then Best Start pay by inland revenues. So we can see that, there's a group, this income isn't just going to people who are already on low income support or then already within the system. So the people who are on more middle incomes. Okay, and then with Barry Milne, we've used this sort of basically the same model, looking at orangutan mariki data, showing that for children and toddlers, babies and toddlers until they were 3, we do see this kind of reduction in child neglect. It's quite dramatic among single mum households, and overall, and for various minority groups, apart from Pacifica, we have got very little data on Pacific. Reduction in referrals to family service. So these are kind of the non-emergency cases, but where there's significant, not just a notification to orangutan mariki, but where kind of that initial social work review said, okay, there's an issue here, we need to investigate, but it's not like we have to do it right now in an emergency case. So, we already know in a way that there are, some benefits purely in income. We know it's reduced child poverty and inequality between households with small children. And we know that it essentially did it's massively really reduced neglect among single mother families. And so in this last one is just showing that actually we're able to link siblings within the data. We're able to show that for children whose siblings, orangutan mariki have a notification of concern for a sibling, we actually see kind of significant reduction. So if there are any unobserved factors at the household level, we're sort of controlling for that in that subgroup. So kind of the next, so that was all funded by the Better Start Big Data Challenge. And then so the next question, which Ministry of Social Development has funded us to look at, big candidate was to look at the before school check. So this, as many of you may know, is free health, behavioural and developmental screening for all 4-year-olds under the in Aotearoa, New Zealand. So this was kind of a really exciting opportunity because we had a universal policy. We both started the first year, and we had a universal health screening tool, right, for all 4-year-olds. So this was going to be the obvious kind of next candidate. And the before school check gives us data across multiple domains of health, so sort of more than people have been able to do when they've done surveys as part of a randomized control trial. Largely, the outcomes we've got are kind of binary. Was there a referral made on the basis of concerns in any of these health domains? But we also have some scales, for instance, parental behavioural assessments through the Strengths and Difficulties questionnaire. We have some scales for the Lift the Lip screening for dental decay and BMI scales and things like that. So we've got a kind of this mix of kind of binary and continuous outcomes, a mix of nurse assessments, largely nurse assessments, but obviously parental reports too. Now, there's some challenges with all administrative data with the before school checks. So some of these are known. So sort of general challenges with using the before school check to measure child health and development. So turns out universal screening isn't actually truly universal. There's always been significant non-participation, about 8 to 15%, as you'd expect. That group is overrepresented with Maori and Pacific families. And so, not only are we not reaching people, there's some systematic bias in that some of the ethnic minorities and some probably the highest risk for poor health families are not getting a before school check. Now, of course, there's been efforts over time to increase that, which have been somewhat successful, but nonetheless, these challenges remain. There's also, even if you do get a before school check, it's a screening, it's not a diagnosis or assessment. It's broad, but it's not necessarily very deep. And when pediatricians, community pediatricians have sort of assessed people, they sort of tallied their assessment of children's health when they started school with their before school checks. They found there's a real systematic missing really of some quite major health and behavioral problems. So it's under identifying health concerns in New Zealand in general, particularly from some of the Northland communities where that study was conducted. And we also know that particularly for the sort of strengths and difficulties questionnaire, which is sort of parental assessments of child behaviour, those are strongly influenced by kind of cultural interpretive biases, translation issues, but also cultural expectations and norms about child behaviour. And we know from qualitative research, focus groups that modern Pacific parents are very worried about, for instance, how the data that they're revealing is going to affect their children. They say things like they don't want to, show concerns as they don't want their children to be labelled at school, for instance. They don't want to be blamed as parents, things like this. So we need to always kind of interpret those data kind of carefully. Now, all of these issues they're known. We can see them, we can measure them to some extent, and they're sort of surmountable. And when I laid out the sort of, we pre-registered the study. We laid out the ways we could address these things transparently and trying to account for them, drawing conclusions from our data. But unfortunately, as we started the analysis after pre-registering the study, for full transparency, we realized that actually there's some really specific challenges with using the full school check to evaluate the families package. So first, if you go back to that initial difference in different slide, is that we do see in some of the key outcomes the kind of non-parallel trends before 2018, so before the kind of year that the families package was introduced. So, I mean, we know sort of trends. BMI has been coming down across all groups in actually New Zealand, which is really good news. Immunizations also be coming down, not so good news. Dental decay has been increasing, but not in an even way. So there might be general trends over this period, but we see jumps. We see jumps before and after July in different years compared to baseline. So that means that we see a jump compared when we go from the babies the first babies whose parents got Best Start in the Families package, and the babies born in the 6 months earlier in the first half of the year, sort of 3 to 6 months earlier. That could just be one of these jumping arounds. So that really complicates our ability to causally infer families package as an effect for those outcomes. There's other outcomes where there are parallel trends. And then kind of the more significant problem, which really I think has led us to sort of say, okay, we're going to look at other health initiative data, which I'll come to, which is the disruptions with COVID-19. So if you count 4 from 2018, 19, 20, 21, 22. So there's the peak of Omicron in New Zealand, really, well, the peak of COVID in terms of cases in New Zealand. And also kind of for the prior years, for the sort of 2017, so we might compare with, particularly in Auckland, they've experienced kind of longer lockdowns in the second half of 2021. So we've got this overall lower participation in the before school check. Now that further excludes high-risk groups. It limits the precision of our estimates we're able to make. But also, not only do we have lower participation overall, we have variation in participation rates that coincides with this being born before or after July 18. So becoming eligible for a check when you turn 4 before and after July 2022. And that really invalidates the sort of difference in designs for the before school checks. It's looking at 4-year-olds. If I just show the data of what happened, so to before school check data completion, we look at by the month that children turned 4 were eligible for before school check. So that's just their birth, the month they were born, plus 4. And we see, so, these rates were actually declining, the end of 2019, because you can get them up until 5. In fact, sometimes you get them, if you start school and you haven't got one, they'll try and do one if you just turn 5, for instance. So, this group could already be seeing some of the effects of COVID lockdown, for instance, in April 2020. kind of, and then we drops, and then we see Auckland obviously drops massively during as a result of the lockdown, the end of 2021, well, from August to December 2021. But we still see this dip actually for the rest of New Zealand as well. So it's not just an Auckland phenomenon. Like our first thought was, well, we can just take out Auckland. Turns out you can't. And then we see it sort of recovering the rates somewhat as well afterwards, but not really ever what it was for, children that didn't turn four, that children that turned four sort of after COVID first came to the shores. So this children after this red line would be the first. So if we wanted to have any treated children, if you like, any children that received the families package, we need some of them born over here. These are by the way, the only first ones that we've got data for school check. Then when we look specifically, so we've got these overall reduced rates. And then we've got this really unfortunate, coinciding with the eligibility for the families package. I eligible for a full school check before and after July 2022. It's the same thing, which is easier to do. It's just screening often sometimes done in kindies or preschool environments, playgroup, etc., play center. But yeah, so you could, it is possible to look at, so here we want non-significant effects, right? So we sort of say, so, okay, if you have the full sample, you could, it's just, yeah, maybe you could look at vision and hearing just about, but remember you're doing it for about still, fewer children than you would have, who was in that group more than, on unobserved characteristics. There might be reasons for that are related with your health. There's good reason to sort of suspect that. And this is true. So these different colors are when we have the full sample, if we take out 2017. So, ones that would have got the check in 2021 to first half of 2022. If you take out Auckland, and 2017. So, in fact, actually, sometimes that's some of the biggest groups. And this is large, right? So this is like close to 25 percentage change in missing data. So, all is not lost. There's still, as I said, there's this really great opportunity with the families package, with the administrative data in the IDI in New Zealand, where the public health system that has great data as well, nationwide, to use other data to look at health and development outcomes for tamariki. Crucially, with these, we wouldn't have to wait till they were 4. We could look at them at 3, for instance. So we get less likely to be affected by the COVID disruptions and the COVID case explosion. Although, of course, we'd still have to look for parallel trends in all of these measures. We'd still have to look for completeness, and be really clear who is not going to be showing up in this data. But for instance, we can look at pharmaceutical collections, for instance, scripts for antibiotics, inhalers, analgesics, like just chronic pain, infections, asthma rate. Again, we're looking at prescriptions and not diagnoses there, but still, I think really, if we combine some of these measures, we could get a picture, because say if primary care increases and secondary care decreases, then we can kind of see what's going on at both ends. Then, for instance, with hospital care, we've got admitted and non-admitted patient data. We can look at the parts which preventably, potentially avoidable hospitalizations, things like gastroenteritis, some infections, for instance. Of course, that's only going to pick up some of the severe cases. It's not, the sort of the broad any referral to a specialist. Injuries, infections, again, they're non-admitted events. If say families package increased access to primary care, that we might expect that to go down. Anyway, so it's kind of, I say we need to sort of get the picture across some of these things. We could look at vaccination rates, just looking at the national immunization register. Still some issues around, handling where it's contraindication, whether it's a refusal or whether it was lack of access. But we would still get a sense of numbers immunized. Then there's mental health services. So again, these are sort of some more of the acute maternal and child mental health and addiction services we could use. But those are not going to include sort of GP or lower level healthcare interventions for mental health. But I think with using a mix of some of these, we could get a picture of health and development for children, and it's certainly more than people who are relying on survey are going to be able to do. So if anybody's interested in collaborating on this stuff, funding some of this stuff, do get in touch, and we can combine forces. So thank you.
Looking at the other options you have for collecting data, I was wondering how you're going to take into account the COVID-19 flip, because we know that after the year after COVID and all the lockdowns and stuff, there was very low rates of influenza and RSV in the country because there hadn't been that influx of people coming to and from New Zealand. And because of that, there would have, I presume, flow on with less hospitalizations and stuff for younger children.
Yeah, I think that's less of an issue because we wouldn't have data from that. They'd be younger than that. Where we'd actually, the advantage of some of this is we'd be using data before COVID. Because you're absolutely right, and other health researchers come up with lots of similar problems to this, that COVID has really disrupted this, both in terms of just access, but also, as you say, this real decrease in things like RSV, and then big increase as borders and things reopened, and people are potentially less exposed. So, but because we're really looking at the first children that got the families package, so really we'd be looking at, and of course they're only really getting the families package sort of 0 to 3 anyway. So in a way, sometimes we kind of want the sort of the short-term effects anyway. So for instance, if your family income then plummets when you're 3 to 4, we're not gonna see that. That's going to complicate the effects of the families package. So I think we looked at it at 3. We wouldn't be seeing kind of the COVID access problems, and we also then wouldn't see the kind of the point you're talking about, which is sort of this kind of significant reduction in infections because of the COVID elimination strategy.
I'm Rose from Ministry for Pacific Peoples. I'm just wondering, because there was a really good presentation on confounding and issues with using natural experiment data, these types of things. But I know that it's really difficult publishing and circulating null findings or findings where you haven't actually found anything, because you were it was really problematic to try and research this question, and there were lots of issues with bias and compounding. Have you tried to publish about this area and trying to use this data?
Yeah, I think it's a really important issue. I think, as I say, I pre-registered the study, and so I kind of have to, which is the good thing about that is I sort of have to write a response to that, why we weren't able to do this. I'm not sure who's going to publish that. I mean, we'll be doing a report, a sort of independent report for the Ministry of Social Development, and they'll probably publish that on their website. But yeah, I think what's really, really important is just the clarity of saying, and my sort of strong preference of saying, we can't do this confidently. We couldn't explain the results. So, some of us will say, okay, well, let's do these really complicated methods. We'll do matching. We'll be really cautious in our conclusions. We'll try and do some kind of, projections and post-analysis stratification and stuff. And I think we could do that, but, it's just the number of counterfactuals is too hard to kind of explain to policy organizations and public and even researchers, right? So I think it's much clearer to just say, we can't do this confidently. We can't use this data to evaluate it, than to try and manipulate it way. And I think that's that's what's been really helpful for me actually doing the sort of going through the pre-registration process is that you know that it's encouraged you to be transparent, but then of course the issue is, you know, who's going to publish that transparency. But I'll just do it as a working paper because I do think it's really important, and I think it's just also to clarify that it's not a null finding; it's that we couldn't look at it finding, right? And that's really important. None of this is saying that the package did or did not have any effect on her. We cannot answer that question with these data. There are other data we can look at.
So in the comparison group of children born before July 2018, was there any thought to exclude from that group the older siblings that were born up to 4 years before younger siblings that get captured in that age group, because they would also benefit from the increased income into the household due to the younger child getting the family package?
Yeah, that is something we could do. I think we actually looked at siblings that we could, as a way of kind of reducing kind of sample, you know, so you'd only look at people that had that were appeared in both data. I think one of the problems is that it's very difficult because the first treated babies would have had to have a sibling 4 years older than them, and that, you know, that again is another kind of selection process. But you're saying just look at effects on the older siblings. I think we could do that, but so when they were 4, so if there's like say a 2-year gap, something we could look at that. We'd have data on that. That's a possibility. You know, big brothers or sisters who got there before school check, maybe before the COVID disruptions, but they would have had a couple of years, 2 to 3 years of the family having the extra money from the family's package. Is that right?
It was not quite right, but I also thought that would be interesting looking at between siblings on those that had time with the family receiving the package and those that didn't. But this one was about just excluding those older siblings that are up to 4 years older from the comparison population, because there would be some potential confounding there, because they would have been benefited by the younger child bringing in that additional income.
So we're looking only at the birth cohorts. We're only looking at those children. We're just looking at the we're matching before school checks on children by birth. So the siblings wouldn't be in that data.
Thank you.